Mental health, anxiety, depression, all of those things are a factor, but they were factors before the pandemic. They're amplified now. We are more conscious of those now. And I think employers are also aware that people have real lives, no matter if they're remote or if they go between a physical office or remote work. And it's a win-win.
Whether it's in a physical location, remote, or hybrid, work can be stressful. According to a 2024 report from Lyra Health, people in remote work situations are facing a post-pandemic surge in serious and complex mental health conditions. Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health and a state specialist with K-State Research and Extension, says we have some issues that we need to address for workforce health and that more companies are working to meet the mental health needs for employees. On today's Sound Living, addressing workforce health. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. While access to care is improving, Johannes says that employers and employees have divergent perspectives on mental health needs for remote workers. Elaine, I don't think anybody would be surprised if we mentioned the fact that jobs are a significant source of stress, and it's not just post-COVID or during COVID. This existed even before COVID.
Yes, Jeff. Some of the data, some of the research clear back to 2017 indicated that people in the workforce called prime working ages, that would be age 25, maybe up to 54, according to some recent info. During those prime working ages, stress in the workforce, stress at the workplace, and then we are seeing now some of that stress that is not managed well can actually relate and originate into anxiety, and then anxiety can lead to feeling depressed. Not clinical, and I'm not a clinician, but the worker who maybe feels disconnected from their workplace, from their work, lack of satisfaction. And so we have some issues we need to address for workforce health.
And when we talk about workforce, we are talking about the entire workforce, whether they are remote workers or whether they are in office or a hybrid, because they're still experiencing the same things.
Yes. Some of the literature that's coming out of worker health, general physical health, does lead us to realize that there's some unique stressors of people that are in hybrid work environments, meaning they can work from home, they can work in a remote environment, but they are still tethered to an actual physical place. So those workers go back and forth. You know, there may be certain days in a physical office or workplace, and then they have opportunity to work away. So their stressors are a little different than the person who is virtually 100% remote, who could work anywhere in the world, who really is not expected to be in close location to an actual physical place. And their stressors are a little different. You know, we are social beings still. And it seems as though from some of the recent literature, and Lyra, which is an international company that does research annually on workforce health in the globe, their 2024 report revealed that actually remote workers who are always online, not needing to be tethered to a physical place, they really seem to generally like it. It allows autonomy, it allows flexibility, it allows a balance between work and home, work life. So yes, it's stressful. Yes, they have to be nimble. They have to be organized to manage the remote demands. But then actually their mental health may be a little better because their personalities, their way of just doing work seems to align with remote, and they don't expect to have a social network at work. Generally, those individuals find their social needs met in other ways. But it's the hybrid worker who may be needing to be close to the office, and that's a different kind of social system than their remote experience, and maybe moving back and forth either physically or technologically is a stressor.
Can also create some more family dynamics as well when you're sometimes in the office, sometimes at home. That can be difficult.
Yes, and it can be difficult if, again, you're in a family that has other needs too. And how do we organize? How do we manage schedules? How do we make sure that the adults in the family have access to the technology when they need it? We know that high school students are still using technology in remote ways. The pandemic taught us that actually education learning can happen through technology and remote work. But it does take some balance between how does the family itself manage when people are going back and forth. From the actual workplace perspective, some of the literature, I mentioned the Lyra report, actually does reveal it's stressful for the employer. So this particular report, it's a global report of companies of 1,000 employees or more across the whole globe, a big focus in the United States, reveals that workers, me as an employee, still assume that the employer will take care of me, that my health insurance will cover mental health care, that the employer will make sure that I am productive and able to work from a health perspective, and that includes my behavioral health. So the employers are assuming and still aware that there are some privacy issues. Some of the employers are doing great strides into provide EAPs, employee assistance programs, some of those more traditional helps with our mental health. But employees, I think, are needing more. The workforce are needing more. Some of the material coming out from other researchers are showing that if there is a champion at the workplace, be it a physical workplace or remote, a champion who is attentive to the mental health of the employee, and the champion who also reveals their own stress experience, meaning that they're relatable. And that's different from an employer's perspective.
It's probably something we're going to, more fine-tune as time goes on. But one of the things I saw also talked about the fact that sometimes it's how people view themselves. Are they introverted? Are they an extrovert? Sometimes it's more of matching our needs with the employer's needs as well.
Yes, and that's a little different than 30, 20, 10, 5 years ago. It's a relationship between the employer and the employee, and it's that matching. You use that word, and that's a really good description about matching the employee's perception of their mental health, their perception of their need, how they contribute to the workplace, be it remote or be it a physical workplace, and then how do they relate to their colleagues. First off, do they even know who their colleagues are if they work remote? And then who their employer is. And if the employer, again, recent literature, if the employer seems to indicate that they can be relatable, that they themselves have had a variety of mental health issues, your supervisor, if your supervisor reveals to a certain point, they too have had stress issues or anxiety, maybe they've had care, that opens up the gateway, the door to having a real relationship with the remote employee and the employee who's in this hybrid position of moving back and forth. And I think that's different from, historically the employer is somewhat removed, maintains privacy, of course, but doesn't really reveal their own dilemmas. But now, since we have workforces that are wanting to have relationship, but not necessarily in the old style around the water cooler, let's all visit together because we're all at the workplace at 8 a.m. and we leave at 5, we have lunches together, that's passé. And so the employers seem to be able to reach out more in a relational way. And the younger employee, that prime age workforce, that age 25 to 54, seem to be ready to have an employer who is more approachable. Gets back to that champion. Boston College has a recent report funded by Prudential, which is a big investment firm. The results indicate that if the employer identifies a champion for mental health, someone that the employees generally trust, feel that they match well. The employees seem to gravitate and share with that champion, and that champion allows there to be very unique kind of helps, be it, yes, workshops are one thing, but how about extra days away for not only physical health issues, but mental health? And it becomes just the matter of fact, this is how we operate, be it for the person who's a worker in remote environments, 100%. The champion is the worker's go-to, per se. The hybrid worker, the worker knows that champion is a real person who may be located close to them, and if the need arises, they can actually have an in-person, face-to-face visit about the need to have additional helps, additional time away, dealing with family dilemmas. So it's a really interesting change, I think, in how workforce mental health is addressed in a very relational way.
How are we doing the team building then in kind of the remote situation where we don't have that face-to-face interaction? Is that something that can be done?
Yes. Quite a bit of information is now made available to the managers of these online environments. Regular check-ins, not just an email check-in, but an actual time, no matter the time zone, because we have workers all over the globe that are connected to another employee group who's, actual check-in. So that mental health champion would actually schedule a time just to talk about relationship and how are we doing as a team, not necessarily production, work project. And then not only those times, then also those opportunities for the employee to not have to respond to emails outside certain times. That is one of the stressors. The Boston College report revealed that, if we could just reduce stress by not responding to emails all the time, if employees know that they can balance and still be productive and still be part of a workforce identity, that's important. Jeff, the other thing that's really kind of elevating this whole workforce mental health is that we don't have enough younger employees coming through the pipeline. So when we think about the population of baby boomers, older adults, of which I am part of, there needs to be a way that younger employee, that younger workforce can thrive, be productive, still meet the needs of their own family and their own commitment to their own health. So versus putting more demands on that younger workforce, can we create a relationship that they can reveal when they need to be off, when they have mental health or stress issues, and how can the employer meet their needs and have a win-win on both sides?
Yeah, because business is always a bottom line operation. So they have to see that making these changes to help the employees also helps the employer and the business.
Yes. It takes a different management style. It takes a different element of trust. And some of the literature shows that from 2022 to 2023, there was some schism between employers requiring people to return to the workplace after the pandemic. It was assumed that we have buildings, we have office spaces, employees will come back full force and there won't be any quibbles about it. I think in the latter part of 2023 and definitely in 2024, there's some kind of an understanding that not everybody can be forced to come back the way it was before. And I do think that the employer-employee relationship around mental health especially will level out. Mental health, anxiety, depression, all of those things are a factor, but they were factors before the pandemic. They're amplified now. We are more conscious of those now. And I think employers are also aware that people have real lives, no matter if they're remote or if they go between a physical office or remote work, and it's a win-win.
That's Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University. More information on managing stress and anxiety is available at county and district extension offices. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.